My name is Rav. I'm a respiratory therapist at Mainland Sleep Diagnostics.
I'm Dal. I'm a registered nurse at Mainland Sleep Diagnostics.
I graduated from Thompson Rivers University. After graduating, I worked at Richmond Hospital in the ICU, as well as a sleep laboratory. I did some training at Stanford University to become a polysomnographic technologist, and that is somebody that works in a sleep lab, measuring and monitoring patients for sleep disorders.
I've worked at Surrey Hospital on the orthopedics unit and then moved out to Richmond and worked in Richmond Hospital on 4 North and surgical unit there, and decided to join Rav at Mainland.
Sleep apnea is a condition where when you're sleeping, your throat collapses. For whatever reason, could be the size of your tongue, maybe it's your jaw, your tonsils, something in the upper airway that's collapsing on top of your breathing tube. And our breathing tube is about 15 centimeters long, and the diameter is about the size of a dime, so it's not very big. So once you fall asleep, for whatever reason, the throat collapses on the top of the breathing tube and you're not getting enough air going into your lungs, which causes the oxygen in the blood to drop. So if you stop breathing for 10 seconds and your oxygen falls by a certain percentage, and you will wake up so that you can resume breathing again. And this can be a serious condition and something that should be treated. The best treatment for moderate to severe sleep apnea is CPAP. Our service is solely based on treating the sleep apnea patient. Our patients that come into our sleep apnea clinics are tired. They feel their quality of life has suffered because they're not sleeping properly. Sometimes they don't know why. Bed partners usually will tell them that you stop breathing at night and you're snoring, but if you're sleeping alone, you wouldn't know that. But generally, I find most of the patients are just tired of feeling always tired. Yeah, and they really want to feel better because quality of life is important.
Mm-hmm. And it makes a huge difference when we see patients from the day we set them up and they come in for their first 6 months. They walk in and they're like, we cannot believe that we went through so long feeling tired. They just didn't know what it felt like to be refreshed and actually have that energy and be able to play with their kids or their grandkids and go out and exercise and do all the things that they wanted to do. You know, the diabetics, their blood sugars have come down. The ones with high blood pressure, your blood pressures are starting to come down. Like they just feel like they've just got a new lease on life.
Yeah, there's many patients that have sleep apnea that have a difficult time trying CPAP equipment. When I was working in the sleep laboratory at Richmond Hospital, I noted that majority of the patients were being charged for trying the machine. Most providers would only give them a month to try it and allow them to try 1 to 2 masks. However, I feel that they need more time to try this equipment. There's many different masks that need to be utilized. I thought that I should try to help the patient by giving them a longer period of time with the equipment, not charging them because not everybody is able to use it, and also providing an in-home service because most of the patients are working and the time that they have is evenings or weekends.
At Mainland, we go above and beyond for our patients. We're very flexible. Everything is based around making sure that patients are happy, whether it be going and see them in the hospital, in home, after hours, trying to, go through a couple of masks, just kind of those little phone calls, lots of follow-up. So it's all about making sure our patients are happy because our goal is to create long-term relationships.
We have respiratory therapists to registered nurses to polysomnographic technologists. The doctors that we work with as well are all board certified sleep physicians. I find the patients that are successful with treating their sleep apnea do have to put an effort into trying the CPAP, to seeing us regularly, trying different masks when they don't work, coming and asking questions. I think the most important thing, if I could tell a patient on how to treat their apnea is come and see us on a regular basis. We're always in the offices. We're open Saturdays. You can call us on our cell phones. We give us your personal cell phones. And I find that over time that these patients that may not have been successful for the first 3, 4, 5 months, if they're committed to seeing us regularly, they'll end up using the CPAP.
The ones that hate it are the ones that come back like 6 months later and they're like, oh my God, we love this. We can't go a night without the machines. In this job, it's just rewarding when you have patients that come in and they're just, it's changed their lives. Like they come in and it's made such a big difference. They've coming in all grumpy and not wanting to start the machine and just can't believe that this is something that they're gonna have to deal with. And they walk out and they're happy. We've got patients that come in monthly that come in and they're just to say thank you, to say, you know what, this has made such a huge difference in our lives.